affecting the reproductive organs of men and women. Now, to answer all these questions, I'm joined by an expert, Dr. Vaishali Sharma, who is in fact a renowned gynecologist. My first question to you is there really a link? When there are multiple studies we have seen international, but when it comes to India, we know a lot of adverse effect of pollution. Can the pollution be linked to infertility in women and miscarriages?
Absolutely. Pollution is definitely linked to infertility and miscarriages, both in males and females. See, because both the eggs and sperms, these are dividing cells. So in our body, when we are grown up, nothing is actually in action, but only our gonads and gametes are in action right now. So they need persistent source of nutrients. They are in active mode right now. So whatever we are eating, whatever we are inhaling, whatever is going inside our body is actually having a major effect on the quality of the gametes. So similarly, if there is rise in air pollution, there are rise in toxins, or the tobacco, if we say, smoking, if we say, all these things, they have some chemicals in them which when inhaled inside, they go definitely directly to the ovaries, to the testes, and in the life cycle of the egg and in the formation of the sperms, they have a major impact. There have been studies in which they have actually seen that there are certain chemicals like benzene. It is quite commonly present in tobacco smokes, vehicle emissions, industrial emissions. So that benzene, when they actually measured it, it inside the follicular fluid of the ovary, the egg which stays in that follicle. So the females who were having high levels of benzene in their ovaries, they were having less egg production, they were having less formation of embryos, and their success rate in IVF was also very less. So there have been clear-cut studies. Air pollution is definitely linked to infertility. It is definitely linked to miscarriages. There is no doubt in that.
When in your experience, when it comes to your patients, because it's an annual problem issue, the pollution. So have you seen that whenever the pollution comes, the issues increases, miscarriages increases, the issues among women increases? The percentage, if you could, the number, if you could tell us.
We definitely get a higher percentage of females who are getting spotting during pregnancy. In last 10 days, if you will ask me, almost I have gotten 4 or 5 females who were pregnant and completely asymptomatic pregnancy, and they have started having spotting and bleeding without any reason. So in a way, obviously we know air pollution is a risk for miscarriage. So they are having symptoms. In case it is not controlled, or if they are not taking proper care, or if they have to travel outside a lot, they are prone to miscarriage. So we always advise them, if you are pregnant, stay indoors, use air purifiers, avoid yourself from being exposed to too much of pollution.
Coming to that, if you could tell us, pregnant women, what are the tips that could be, or advice that you would give to a pregnant woman?
So all the pregnant women, we advise that they need to stay indoors. Stay away from major roads or the areas where there is too much of vehicle to and fro. There are too much of industrial emission. So try to stay indoors. Use air purifiers inside, and avoid any kind of emission. In fact, tobacco smoking is also one of the reasons. Pollution and the tobacco smoking is more or less the same. So in that case also, that is also very detrimental. Avoid from that, obviously, active smoking, and also protect yourself from passive smoking.
So those were some of the advices and tips that has been given by Dr. Vaishali. In case you are pregnant, you're carrying a child, then it requires you to be extra careful when it compares to other population. There are multiple